When patients are meaningfully involved in rare disease research, the outcomes don't just improve, they are transformed. But too often, research models leave out the people most affected. That leads to data gaps, inconsistent application of patient-reported outcomes, limited attention to caregiver impact, and the underrepresentation of entire populations, such as children and other communities that are often left out of research. Here's an example I encountered in my own work. A value assessment of a treatment relied on a measure of benefit called the 6-minute walk test. But to a mother of a patient who is a young boy in a wheelchair, this measure isn't relevant, as there's no way this treatment was going to allow him to walk for 6 minutes. What mattered most to him and his family was whether he could use his hands to steer his motorized wheelchair. This measure didn't reflect his reality and said nothing about optimal outcomes of the treatment for patients like him.
So I was a patient advisor on a research study focused on the overall economic and emotional burden of myasthenia gravis on patients and caregivers. At first, the researchers were thinking about caregiving in a very narrow way, but caregiving for this population is so much broader. It includes all the ways others have to step in to compensate for what a patient can no longer do, like childcare costs, travel to specialists, delivery services, adaptive tools, and other out-of-pocket expenses that are definitely tied to the disease, but they're never captured or rarely captured in research. So as patients and caregiver advisors, we pushed for a much broader definition of caregiving, which led to findings that were honestly pretty shocking to the researchers and brought attention to a level of impact that likely wouldn't have surfaced without our input.
This is the power of patient-centered evidence. It surfaces what really matters to patients. When patients help shape the research model, we see stronger data for clinical and payer decision-making, policy decisions grounded in lived experience, and earlier, more equitable access to care and improved patient outcomes.
In rare disease value research, engaging patients and caregivers isn't just the right thing to do. It's essential to producing relevant, trustworthy evidence. That's why we've developed a clear, actionable framework for meaningful patient engagement across the research lifecycle. Step 1, engage early. Patient voices should shape your research from the very beginning, not just at the end. When patients are part of shaping what you want to measure, you're more likely to generate insights that matter to them in real life. And by the way, both regulatory and reimbursement agency really appreciate this. Step 2, build partnerships with patients from diverse backgrounds. Don't rely on the same sources and again. Proactively engage different patients from diverse backgrounds across different geographies and health status. This matters especially in rare diseases, where very often the disease experience can differ from patient to patient. Step 3, co-create evidence. What are you measuring and why? Work with patients to define meaningful outcome measures. Clinical data are important, but remember that for many rare diseases, we do not yet have measures that adequately capture patient-relevant outcomes. Think about how to best capture or track quality of life, daily function, or even caregiver impact. Step 4, close the loop. Patients need to know their input made a difference. Sharing how their insights shape the methods or findings builds trust and lays the groundwork for deeper collaboration next time. Consider too how to acknowledge their contribution as part of the scientific publication process.
To help research teams put these steps into practice, we created a tool, the Rare Disease Patient Engagement Checklist. It's designed to help researchers engage patient voices thoughtfully, consistently, and with clarity every step of the way. The checklist is structured around the entire research process, from planning and evidence development to assessment and policy translation. For example, in the initiation and planning phase, we ask, have patients, caregivers, and patient advocacy groups been engaged early and throughout the research process? In the execution phase, we prompt you to consider whether patient preferences are consistently integrated into the economic evaluation framework, ensuring alignment with what matters most to patients. Under monitoring, we ask, is evidence derived from current patient experience data, and do researchers acknowledge where there are gaps in that evidence? And finally, in the dissemination and assessment phase, we ask, are patients and caregivers actively involved in dissemination activities? And does the process include transparent communication and feedback to ensure relevance, clarity, and trustworthiness?
Each section of the checklist includes real-world examples, practical suggestions, and space for your team to reflect and improve over time. This checklist isn't a formality. It's a roadmap for doing better science. When researchers commit to meaningful engagement, the results speak for themselves. More substantial evidence, more responsive policies, and better outcomes for patients and caregivers.
Think about it. Once the research questions are written and evidence is collected, you can't go back and capture what was never asked. So, early patient involvement helps ensure research reflects the lived experience, not just the clinical perspective, and it prevents the gaps that can't be fixed later. If we want research that reflects real life, patients and caregivers must be a part of it. Early and preferably always.